Hello and welcome to our fifth episode of For the Communities Grand Cycle It Under 8 Minutes. I'm your host Chinmy Kumar from Asia Pacific Regional Learning Hub. Today we are diving into the word that is very much into the heart of Grand Cycle 8. It's integration. In a world of shrinking budgets, shifting health priorities, and moving away from silos towards the unified health system, but there are lots of questions on what does this actually mean for our HIV, TB, and malaria programs and the communities. To help us unpack the new enabling guidance on integration, I am joined by Estrella Lasry, Senior Integration Specialist within the Health System Strengthening at the Global Fund. Estrella, welcome to the podcast.
Thank you, and thanks for having me here.
Get into the essentials. Estrella, my first question to you is what does integration actually mean in the context of GC8 and why it has become such a high priority for the three diseases?
Thank you, and thanks for the question. I think it's important, and it's a question I get asked very often. So integration refers to the process of delivering HIV, TB, and malaria services in a coordinated way, anchored on primary healthcare and health systems. It's about organizing services around people's needs rather than around the program's needs. So with the objectives of ensuring a more people-centered approach, so responding to what the people's needs or population needs or patient needs, depending on the service, and also to create efficiencies. As you mentioned, we're in a complex financing landscape throughout, and so we need to be able to do more or the same with less resources. And integration is a means to be able to reach this and to also be able to uh, 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 help countries go smoothly on the path to more sustainable approaches. Integration is a means to an end. It's not an end in itself to reach these objectives. And so it should be integrated activities should be planned if they are contributing to those objectives. They should also be monitored to see if they are contributing to the objectives of more people-centeredness and more efficiency.
Thank you so much. That really clarifies the why behind the shift. But it's about efficiency and sustainability. But for many key population, integration can sometimes they also feel like invisible. To help them know and to help our advocates, what are the real world risk or red flags that communities should look out for during this integration?
So community engagement is one of the main principles of integration. And we are very aware that that integration does not come without any risks, and so it is important to recognize those risks up front to be able to have to implement mitigation strategies for those risks. So for the communities and key and vulnerable populations, one of the mitigation strategies is to ensure that communities and key populations are involved in the design, in the implementation, and in the monitoring of integrated activities, so that they can alert when integration is limiting access and when integration is not contributing to more people centeredness. It will not always be easy for communities for the end users to define whether they are contributing to efficiency or not, and it's not so much it's less the community's concern, but communities will be at the center of ensuring that integrated activities are not decreasing access or decreasing quality for that matter. And so there are several mitigation strategies to do that. One of them is a few things. One is integration doesn't need to happen everywhere and at the same time. So one mitigation strategy is to implement activities, integrated activities in a paced way, so that we can learn from how they're contributing to better people centeredness and to better access and not at the detriment of quality. And so one of them is to include them in a paced approach. Another one, as I mentioned before, is to include communities in the design and in the implementation. And this can also be ensured through social contracting and ensuring that and some countries are choosing to have community grants so that there can be a continued access for communities and continued implementation through communities. And then another strategy is community-led monitoring, integrated community-led monitoring that allows for the communities to be redundant, but to be monitoring and providing feedback on how activities are being integrated and how activities are being delivered.
Yeah, and I completely agree. Like, it's a delicate balance, to be very honest, when it comes to integrating services within country. But since our listeners are the ones who will be in those CCM rooms and, like, discussing with grant writing teams, what are the three top key messages or non-negotiables that communities should bring into the dialogue of integration?
So the non-negotiables should be one, that they're involved in that they are part, the communities are part, community representatives are part of the discussion. And here I would say so community representatives from HIV are very often in the CCMs, but they're less present for TB and malaria. Now, we don't need to create another silo within the communities. But what I would say is, when as a community representative, think of representing the broader health service delivery approach, and think, okay, you might be a person living with HIV, but your family is also accessing services for other components. So just think of how in CLM, for example, how the health services are being delivered. Are they sufficient? Are they appropriate? Are they is the quality sufficient enough? Is there sufficient access? So that would be the first one. Just don't negotiate on a seat at the table, but make sure that you represent the broader community needs, and not a silo specific disease one only. And then and ensure that there are sufficient funds, but also offer some input for what the trade-offs are. We have a lot of difficulty we have a lot of ease at saying this is needed, that is needed, that is needed, but less so in what can be deprioritized. And right now, it will be important for communities to ensure that they have also input on what the trade-offs can be, and where your red lines are on trade-offs.
Estrella, thank you so much for giving us these key messages. Like, you have given us a clear roadmap in terms of the integration.
Thanks for having me, and really the community's contributions to integration have been super useful. We've included your feedback in the guidance as well. So this is taken into consideration, but we will only be able to do this with communities, and really with communities providing that feedback. So just make sure that you continue to engage with us in the way that you've been doing up to now. Thank you.
Thank you so much. To our community partners, integration is definitely coming, and it is up to us to ensure that this leads to a better access and not barriers to us. We want to ensure this transition is built with us and for us. Please share this video with your CCM representatives and technical working groups today. Don't forget to subscribe to our YouTube channel and our newsletter page. I am Chinmy Kumar once again. Thank you so much. See you in next 8 minutes.